Hello everyone, this is Dr. Mandeep and I welcome you all to the clinical case series by Nextillo. So this video is about the normal vital signs and the normal lab values. This video is important because before we dive into the case, we should have some understanding what are normal vital signs and normal lab values, so as it's easy to understand for everyone as we go through the case, right? So let's begin. So the first vital sign that we are going to discuss is blood pressure, and it has two components, the systolic blood pressure and the diastolic blood pressure. So two components, systolic blood pressure and the diastolic blood pressure. The systolic blood pressure is normally between 90 to 120 and the diastolic is between 60 to 90. The units are millimeters of mercury. What is abnormal? The abnormal is hypotension. So, in hypotension, the blood pressure is less than 90 by 60. So, for hypotension, it should be less than 90 by 60. And for hypertension, the blood pressure should be equal to or more than 140 by 90. Let's move on to the next vital sign. The next vital sign is pulse rate. So, it is the number of pulses in a minute. Normally, the pulse rate is between 60 to 100 per minute. It is 60 to 100 per minute. And what is bradycardia? When pulse rate is less than 60, and tachycardia is when the pulse rate is more than 100. So, bradycardia when the pulse rate is less than 60, and tachycardia when it is more than 100. Let's move on to the next vital sign. The next vital sign is saturation, SpO2. Normally, the oxygen saturation of the blood is more than or equal to 94%. If it is less than that, it is abnormal. So, anything 93% or less is abnormal. Let's move on to the next vital sign, which is temperature. Normally, the rectal temperature is 98.6. The rectal temperature is 98.6 degree Fahrenheit. So, what is hypothermia? When the temperature is less than 95, and hyperthermia is when the temperature is more than 106. So, hypothermia if it is less than 95, and hyperthermia when it is more than 106. Right? I think everyone followed that. The next vital sign is respiratory rate. Normal respiratory rate is the number of breaths taken in a minute. So, it is between 12 to 18 breaths per minute. And what is tachypnea? When the respiratory rate is more than 18. The next vital sign, it's not a vital sign, rather it's a lab value which is part of emergency evaluation of patients, which is random blood sugar, RBS. That is random blood sugar. The normal value is 70 to 140 milligrams per deciliter. There's another vital of the emergency, which is pain. We are not going to discuss that right now. Let's move on to the lab values. So we are going to discuss three lab investigations. The first one is CBC, the second one is LFT, and the last one is the RFT. We'll go into a little bit details, not much, so as it's easy for everyone to understand. So let's begin with CBC. The first value is HP. The second value that we are going to study is total leukocyte count. The next one is the platelet count. The next is MCV, mean corpuscular volume, MCHC, mean corpuscular hemoglobin concentration, and the last one in CBC is the RDW, that is red cell distribution width. So let's start with HB. So the HB is different for men and women. Normally it's between 14 to 18 grams per deciliter for men, and for women it's between 12 to 16 grams per deciliter. Obviously, these lab values, they apply to adults, not to other age groups. The next lab value, that is total leukocyte count, it is normally between 4,000 to 11,000 per millimeter cube. So the normal TSE between 4,000 to 11,000 per millimeter cube. The next value is the platelet count, which is between 1.5 to 4 lakh per millimeter cube. That is 1.5 to 4 lakhs per millimeter cube. The MCV, the normal MCV is between 80 to 100 femtoliters. The next one is MCHC. So it is normally between 32 to 34 grams per deciliter. The red cell distribution width is expressed in the form of percentage. So it is normally between 12 to 15%. 12 to 15%. We are done with the values of CBC. Let's move on to the LFTs. The LFTs. The values that we are going to study here are SGOT, SGPT, total serum bilirubin concentration, total protein, and the last one is total albumin concentration. For both SGOT and SGPT, the upper limit is 40. That is 40 for both. That is units per liter. Units per liter. For total serum bilirubin concentration, it is normally between 0.3 to 1 milligrams per deciliter. For total proteins, it is between 6 to 8 grams per liter. 6 to 8 grams per liter. For total albumin concentration, it's between 3.5 to 5 grams per liter. We are done with LFTs. Let's move on to the renal function test. The renal function tests, here we are going to discuss urea concentration, the serum creatinine, and then sodium and potassium. These four values are important for the cases and everyone needs to know them. The first one, the urea, is normally between 20 to 40 milligrams per deciliter. The serum creatinine value may vary for men and women because of difference in muscle mass, but we could safely say it is normally between 0.6 to 1.1 milligrams per deciliter. The normal sodium is between 135 to 145 milliequivalents per liter, and for potassium it's 3.5 to 5 milliequivalents per liter. The difference in sodium and potassium is because sodium is primarily extracellular and the potassium is intracellular. That is why there is wide variation in the concentration levels of sodium and potassium. And this is where I will end the video. And after this video, I want all of you guys to start with the case series. And I hope you enjoy the learning experience with Nextillo. Goodbye and take care.